Hello, this is Dr. JoAnn Manson, professor of medicine at Harvard Medical School and Brigham Women's Hospital. I'd like to talk with you about a recent report in the journal Annals of Internal Medicine by researchers at the Mayo Clinic that leveraged the large-scale UK Biobank, more than 380,000 men and women, to answer a very important question about whether the commonly used coronary heart disease, CHD, risk calculators, risk scores, could be improved by the addition of genetic factors such as an ancestry-specific polygenic risk score, or by the addition of lifestyle, psychological, and social determinants of health factors. And in the latter category of the social and lifestyle factors, they specifically included behavioral factors such as physical activity, sleep quality, psychological factors such as anxiety, stress, depression, and social determinants of health, including educational attainment, income, occupation, housing, social relationships such as with family and friends. And they tested 3 different 10-year CHD risk scores. CHD was defined as MI, or coronary revascularization, and the scores included PREVENT, pooled cohort equation, and something called Q-risk-3. And what they found was that the addition of these scores, either alone or jointly, did improve the prediction of CHD. And for one standard deviation increase in each of these scores, they saw about a 40 to 60% increase in the hazard ratio for CHD. And when testing for risk prediction using traditional methods such as percent reclassification or the C statistic, they saw clear improvement with reclassification. They saw about 12% reclassification, more accurate classification of participants, usually toward higher risk. And they also saw meaningful improvement in the C statistic. So, of course, these findings need to be replicated, and adding genetic factors would be associated with higher costs and also logistical complexities. But adding some of the lifestyle, psychological, social determinants of health factors actually could be done fairly readily. And it appears that adding these factors could identify high-risk individuals more accurately and could potentially lead to earlier implementation of intensive lifestyle or behavioral counseling, or earlier implementation, institution of medications such as statins to lower risk. Thank you so much for your attention. This is JoAnn Manson.